welcome to The Doctors. My name is Sarah, and I'm here with my co-host Jenna. Today we have the pleasure of sitting down with two cardiologists and discussing information about an amazing drug that they prescribe to most of their patients. But before they come out, I'll let Jenna tell you more about it.
Thank you, Sarah. The drug's name is Digoxin, also known as Digoxin. It's classified as an inotrope, or a cardiac glycoside. The key indications for the use of digoxin are atrial fibrillation, atrial flutter, and heart failure. We're so excited to learn more about this drug and educate our viewers at home.
And without further ado, these two cardiologists have received the pleasure of studying at Harvard Medical School and working on cardiac floors at the most prestigious hospitals throughout Illinois. Please join me in welcoming Dr. Lauren and Dr. Paulina.
Thank you for that wonderful welcome.
Thank you. I'm so glad to be here.
We have already gave a short overview of digoxin, but can you tell us in further detail how this drug actually works for your patients?
Sure. Digoxin is a great drug for the management of heart diseases. It improves the contractibility and pumping of the heart with a cardiotonic effect by increasing the availability of intracellular calcium levels in the heart muscle to achieve the desired increase in muscle action.
That's so impressive. So it helps improve the contractions and pumping of the heart by strengthening the heartbeat. Now, Dr. Lauren, can you explain the effect of digoxin on patients with atrial dysrhythmias?
Of course, a patient with atrial dysrhythmias has a problem with the heart beating at a normal rate. Digoxin slows the rate of ventricular contraction by inducing a negative chronotropic effect. First, digoxin has a direct depression effect on the cardiac contraction tissues. This action decreases the number of electrical impulses allowed. Secondly, digoxin indirectly stimulates the vagus nerve, which acts to slow the heart rate.
Interesting. Therefore, digoxin slows the heart rate. Now, we know that there are always pros and cons to every drug out there, and that being said, Dr. Paulina, can you quickly tell us about some adverse effects of this drug?
Digoxin is known for its narrow therapeutic index, so that puts patients at a higher risk of toxicity. Signs and symptoms of toxicity includes potentially life-threatening heart disturbances and premature ventricular contractions, or PVCs, which I like to tell my patients are like skipped heart rates. However, PVCs may happen because of other causes, making it not specific to digoxin toxicity.
Yes, but some other adverse effects might be nausea and vomiting, lack of appetite, abdominal discomfort, blurred vision, and mental changes.
It seems like if this drug is used properly, there won't be as many life-threatening changes happening to the body. Can you tell us some important patient teaching guidelines to make sure these changes don't happen?
Yes, well, for me, I like to remind my patients that it is a long-term therapy. Some patients think that they can start the drug and everything will be fine and everything's fixed, but that's not the case. Also, you want to take digoxin daily at the same time using the same drug. You do not want to switch brands without consulting your healthcare provider.
I like to tell my patients about administering the drug correctly. Never miss a dose. However, we know it may happen, but if you do forget and it's within 6 hours of the time you usually take the drug, then you can take the daily dose. Do not ever take extra dose or double dose, and make sure to take digoxin with food or after a meal. Try to avoid dairy products because it does delay absorption of the drug. It can be crushed if needed, and do not take other drugs without consulting your healthcare provider first.
That was some pretty great information, and I hope our viewers at home take account of those tips. Are there any exams or diet restrictions that the viewers should be aware of?
Have physical exams, electrocardiograms, and drug tests as needed. These can check the digoxin levels and electrolytes like sodium, potassium, and magnesium. These can also be used to monitor body's responses and determine if there is a need for dosage changes.
Yeah, and as far as diet, you want to limit your sodium and get an adequate intake of potassium. If you're taking a loop diuretic like Lasix, potassium levels can contribute to the adverse effects of digoxin.
And I know you mentioned some times previously when you should contact your doctor, but are there any other specific times you should call them?
Yeah, I tell my patients that you need to count your pulse for a full minute using your wrist prior to taking digoxin. If it's less than 60 beats per minute, you want to hold the dosage and notify your healthcare provider.
I like to tell my patients to report adverse effects such as changes in heart or rhythm, nausea and vomiting or visual changes, and report those to your healthcare providers immediately.
Well, I'd like to take this time to thank you, Dr. Lauren and Dr. Paulina, for taking the time out of your busy schedule to sit down and talk with us. It has been an amazing pleasure to receive the great amount of information that both of you provided.
Yes, thank you.
Thank you. Thank you.
Don't touch the dial. The doctors will be right back.